It's no secret that autoimmune diseases can cause severe dry eye. One of the conditions that results in a more severe type of dry eye syndrome is called Sjogren's syndrome. In today's video, I'll tell you all about it and how its treatment differs from that of dry eye caused by other factors.
Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week.
You've made it to Eye School with me, Dr. D. Welcome, make yourself comfy and get ready to learn about Sjogren's syndrome. Before we get started, this channel is all about eye education and I love creating this community of pupils. If you're here for dry eye, you found this video because you were searching for it, I actually have a playlist that I'll leave here for you to check out. There's all kinds of education there about dry eye and blepharitis that I hope you'll find useful. So what is Sjogren's syndrome? Sjogren's is a chronic autoimmune disease. Autoimmune diseases occur when the body is attacking itself. Although Sjogren's is often listed as a dry eye, dry mouth disease, it is actually considered systemic and therefore affects the entire body. Sjogren's is known for attacking the secretory glands like the parotid that secretes saliva and the lacrimal that secretes the watery layer of your tears. And so that's why we have, that fame for causing dry eyes and dry mouth. So in terms of who Sjogren's affects, I had a mentor in school tell me that you can often spot a Sjogren's patient when they come into your office because they'll show up in your dry eye center with a huge bottle of water in tow. And before the visit is over, they'll ask you where the water fountain is to refill it. It occurs most frequently in women, with 9 out of 10 Sjogren's patients being women. It's estimated that as many as 4 million Americans have Sjogren's, with over half currently undiagnosed. It can occur in all age groups, but the average age of diagnosis is 40 years old. But the funny thing about that is it can often take over 2 years to receive that Sjogren's diagnosis. So even though that mean age is 40, those symptoms are coming on a lot of times in the 30s. So in addition to having a dry eyes and a dry mouth, Sjogren's patients often can have a general sense of fatigue, as well as potentially some joint pain or digestive issues. This is going to depend on the patient, but it's due to the fact that it is a systemic autoimmune disease. The Sjogren's Foundation also lists more systemic issues like dysfunction of the kidneys, the gastrointestinal system, blood vessels, lungs, liver, pancreas, and even the nervous system can be affected. Sjogren's is fairly common in general and certainly very commonly seen in dry eye clinics like mine. However, often my patients have not yet been diagnosed with Sjogren's. Symptoms are often difficult to suss out because they overlap with other system-wide conditions like other autoimmune diseases, effects of medications, or even menopause. As an eye doctor, I frequently run tests to diagnose Sjogren's, but your dentist or your rheumatologist is very likely to initiate testing as well. I often suspect Sjogren's syndrome in my patients, especially if there's a history of dry mouth or cavities, as well as the case where you've got dry eye and just a ton of inflammation and lack of tears without any problems with the lids. So whenever I'm seeing all that surface inflammation in the tear film on the ocular surface, but no real meibomian gland problems, that's definitely a tip off for me that the person could have Sjogren's. I use several blood tests for Sjogren's. There's the traditional SSA and SSB. Those are the Rho and La marker antibodies for Sjogren's. And I also order a panel called the Sjo test that measures 9 additional markers. And I found that this test is more sensitive than simply testing Rho and La. Your doctor may also recommend a salivary gland biopsy where a small piece of tissue is taken from the lower lip. This test confirms lymphocytic infiltration of the minor salivary glands and gives a positive diagnosis of Sjogren's. So let's talk a little bit about treatment for Sjogren's. Since I'm an eye doctor and a dry eye specialist, my focus, pun intended, is on the treatment of dry eye related to Sjogren's. And all of the typical dry eye treatments do apply for patients with Sjogren's syndrome. Your doctor could recommend non-preserved artificial tears. Here's my video about my top 5. Modifying your diet. Here's my video about home remedies. Taking omega-3 supplements, anti-inflammatories, longer term inflammation control like Restasis, Cequa, or Xiidra. Once the inflammation on the ocular surface is controlled, we'll sometimes use punctal plugs to keep the tears on your eye longer. We can also use treatments like autologous serum drops. Those are drops that we make from drawing your own blood, spinning it down and using the serum in an artificial tear. That heals the ocular surface. We can do amniotic membranes, which are dehydrated tissue from placentas. So when a person has dry eye syndrome, and I get that positive diagnosis of Sjogren's syndrome as well, it does make me a little bit more aggressive because I know that Sjogren's is very aggressively causative of dry eye. And so I'm a little more prone to get you on secretory right away, get you on those anti-inflammatories right away, use steroids to calm it down, and we're really going after that inflammation. Obviously, I'm balancing that with all of the other signs I might see and your symptoms, and so we may have a component of taking care of your lids and taking care of the inflammation on the ocular surface. But in general, for me, I'm a little bit more aggressive in my Sjogren's patients. In addition, I've got some other options. I'll often use secretagogues, Evazac or oral pilocarpine help with creating more fluid in general, and so we'll experiment with doses and get you on the right amount to make more tears yourself. So I've got a case study I can share with you. This is a recent patient in my dry eye clinic. It's a 78-year-old female that presented with extensive history of dry eye disease. She'd been diagnosed with rosacea. She was very suspicious for Sjogren's. Her eyes would burn. Anytime she used anything, artificial tears or Restasis, her eyes just felt terrible all the time. She actually came in with a bag full of eye drops and just said her eyes felt terrible no matter what she used. So I've got the picture from her first day. In her dry eye evaluation, she had dry spots all over her entire cornea. You can see it lighting up over here, green everywhere. And that's an indicator that we have dry spots all over the cornea. This patient, when I looked at her, had concurrent meibomian gland dysfunction and other autoimmune disease as well systemically. And so she was taking all of these medications in the bag. It was a mix of artificial tears with preservative and without preservative, ointments, allergy drops, just you name it, she had some of it in the bag. And so the treatment for her, we actually started her on a doxycycline course, which was for the meibomian gland dysfunction. I let her continue the Xiidra, and then we went through the bag and eliminated absolutely every drop that had any preservative in it. And when she came back for her 3-month appointment, we also checked in on home remedies, warm compresses, artificial tears, looking at her makeup, auditing all of that. And when she came back 3 months later, this is her cornea. So we still have dry spots on this cornea, some fluorescein staining. However, you can see that those green tears are much more fluid, more solid. We don't have those lighted up areas everywhere like we did at the first visit. So not a complete case presentation, just kind of a quick before and after of somebody with Sjogren's, but I wanted to share that with you guys. It was just top of mind, and we're talking about Sjogren's, so I wanted you to see it. Ultimately, if you do have Sjogren's syndrome or if you suspect that you do, go see your eye doctor and ask them about testing so that you can find out for sure. If you do have Sjogren's, I would highly recommend getting your eye doctor on board, letting your dentist know because there are oral implications as well of Sjogren's, and then also getting a rheumatologist lined up so you can get that systemically under control. I hope you enjoyed today's video about Sjogren's syndrome. Make sure to leave me comments down below if you've experienced Sjogren's or if you think you might have it. I like to interact with you guys in the comments. That is it for today's iSchool lesson. Thanks for coming to class today. I'll see you next time.